What methods pinpoint a specific muscular dystrophy subtype? Imagine trying to solve a complex puzzle where each piece reveals a different part of a person's health story. That's exactly what doctors do when they try to identify the exact type of muscular dystrophy a person has. It's a careful process that combines several methods to get the full picture. First, doctors start with a detailed history, asking about symptoms, when they began, and if other family members are affected. This helps spot patterns typical of certain subtypes. Then, a physical exam looks at which muscles are weak and how they are affected, giving clues about the specific muscular dystrophy involved. Blood tests are next, especially measuring creatine kinase levels. Elevated levels mean muscle damage is happening, but it doesn't tell us which type. To get more specific, doctors use electromyography, or EMG, which measures electrical signals in muscles. This test helps distinguish between muscle problems and nerve issues but doesn't identify the exact subtype. The real key comes from muscle biopsies. A tiny piece of muscle is surgically taken and examined under a microscope. Here, doctors look for signs like muscle fiber damage, regeneration, and connective tissue buildup. They also use special stains to detect specific proteins in muscle cells. For example, if dystrophin is missing or reduced, it points toward Duchenne or Becker muscular dystrophy. If other proteins like sarcoglycans or dysferlin are absent, it suggests different limb girdle or distal muscular dystrophies. Genetic testing is now the gold standard for pinpointing the exact subtype. Blood samples are analyzed for mutations or deletions in genes known to cause specific types. Techniques like DNA sequencing and multiplex polymerase chain reaction help identify these genetic changes. This method is highly accurate and less invasive than a muscle biopsy. Sometimes, imaging techniques like magnetic resonance imaging or ultrasound are used to see patterns of muscle involvement. Certain muscles may show fatty replacement or atrophy that hints at specific subtypes. In some congenital muscular dystrophies, brain imaging can reveal abnormalities like white matter changes, which support the diagnosis. Overall, combining clinical evaluation, blood tests, muscle biopsy, genetic analysis, and imaging allows healthcare professionals to accurately identify the subtype of muscular dystrophy. This detailed approach is essential because it guides treatment options, helps predict disease progression, and informs family planning. Remember, each person's experience is unique, and diagnosis should always be done by trained medical experts. If you or someone you know is concerned about muscular dystrophy, consulting a healthcare professional is the best step to get personalized and accurate information.